Another thing that they've improved greatly in the past, you know, how many years, 15 years, is the ability to protect your bladder while you're having the chemotherapy, because it runs right through your kidneys and right through your bladder. And at the time, they didn't have any kind of medications to counteract that effect. So what the amount that I had between the first round of chemotherapy and then the second round of chemotherapy did some damage that way, so that I have chronic hemorrhagic cystitis, which is having a lot of blood in your urine and things like that. I have many, many, many urinary tract infections, and they believe that that's a result of not just the chemotherapy, but I also had a radiation to that area as well. So that's what did it in between those two. So it's not really repairable. It's gotten much, much better with time. So at like 15 years out, it's, you know, doesn't affect my daily life. At the time that I had radiation, I didn't know until after I was done with it, into a few months after it, that it would result in menopause, so that I wouldn't be able to have children. I didn't realize it until it started to happen, until I recognized the effects of it, hot flashes and mood changes and all those things, and finally, you know, I was in the middle of back on chemotherapy, and went back and they said, no, you're going through menopause. And not that anything could have been done with it at the time. I mean, I think if now someone would be going through it, they have ways to harvest eggs and things like that to save them for when you're older and when you want to use them. But in 1986, once again, they didn't have that kind of technology. So, but yeah, it was surprising, and probably I'd have to say the major effect that, you know, the treatment had is that lingering infertility. Osteoporosis. That goes back to also with the not having any ovarian function. While they're trying to figure out what level of medication that I should be kept on long term, they were trying to figure it out, and it went through a bunch of different years trying to figure out, you know, did I have too much, did I have too little, or whatever, and I suffered some bone loss as a result. So on the bone scans that I've had to see what my bone levels are and whether I'm at my mark for my age, they've always fallen less than that, and they call it osteopenia. So, and now that I'm over 30, you don't grow any bone further after you're 30 years old. So it will only lose bone from here. So I've definitely underneath my mark of where I should be at this age. And I take vitamin D, I take calcium, and I do weight-bearing exercises to try to maintain the bone that I do have. My name is Lynne R, and I'm an 18-year rhabdomyosarcoma survivor.